get started. I know we're a couple minutes behind, but thank you all for being here. If you don't know me, my name's John Miller, and I'm a partner at the law firm of Boy Agnew Potanovic. And I'm also the co-chair of the Lee County Bar Association Health and Wellness Committee. And we got together with Lauren, our executive director, and Jessica Bennett, who you hear from in a moment, and came up with the idea for this CLE, which is called Self-Care in Demanding Roles. I'm going to stop talking here very soon because I am not the person you came to hear, but I do want to introduce you guys to Jessica Bennett from Park Royal Hospital. She is the business development representative, and she's going to give you a little bit of a introduction to Park Royal Hospital if you don't know about it, and then we will hopefully transition pretty quickly into the CLE with Lisa Mann. Jessica?
Hi, thank you so much. As he said, I'm Jessica. I'm with Park Royal Behavioral Health Hospital, and we are a private 114 bed behavioral health hospital. And our 114 beds is divided into 5 specialty units. We have a geriatric unit for seniors struggling with cognitive decline and dementia with behaviors. We have an all women's unit where we address women's issues. We have a 7-day trauma curriculum on that unit and all women's staff. We have a co-occurring unit where we treat detox and co-occurring disorders, mental health, and substance abuse. And then we have an acute unit where we treat patients who are aggressive and psychotic, and a subacute unit for those who might be a little bit more high functioning. The main thing that we treat, or what we see the most of, is probably suicidal ideations, especially right now with all of the isolation and anxiety going on today. There's a lot of depression and also a lot of detox. That's probably been the biggest increase since COVID is detox. And so that's why Lisa Mann came up with this presentation about how to take care of yourself during demanding roles, because in order to take care of others, we have to be able to take care of ourselves. And in the midst of a pandemic, it is very important. So I'm not sure if she has hopped on yet. That's kind of our services in a nutshell. We accept all insurances, including Medicare and managed Medicaid. And it's really not, behavioral health hospital is not what you would picture from like One Flew Over the Cuckoo's Nest. It's more of, there is acute psychotic patients, but there's also people like us who are struggling to adapt to certain circumstances and just need a little help. Need some crisis stabilization. So, and we do also have outpatient IOP and PHP, which is intensive outpatient. And we do that virtually as well as in person. And I will put my information in the chat if anybody needs to contact us for more information. Sorry. Give me 1 second. I will. Does anyone have any questions about that?
Jessica, where is your facility at, and do you have more than one here located in Florida?
So Acadia Healthcare owns us, and we have one in Tampa. We're in Fort Myers, and Acadia Healthcare also has a hospital in Tampa and also has wellness residential in Boca Raton. They treat substance abuse. And then we have a trauma residential facility in Ocala, Florida. We have 12 Oaks in the Panhandle area, and that is also substance abuse treatment. But the closest one in this area is going to be Fort Myers, and it's called Park Royal Hospital.
And do you guys currently have a relationship with the courts here in the 20th Circuit? I know you're private, but do you have any relationship to our local, any local government entities?
Yes, so Lance Franklin actually works with the court system, and he works with people who are coming out of jail and need substance abuse treatment. So he works with is it Judge Schwett? Is that right?
Yeah, that's correct.
Yes.
Okay. I'm not real familiar with them because I don't work with them. I've met them once. And then there's a social worker, and there's a team of people working with the jail reentry. So he also works with the jail reentry program and Judge Schwett's office and his team.
And for those of you wondering where Lisa is, she obviously actively practices at the hospital, and she has gotten caught up in hospital-related issues, and we're trying to get her on the chat as quickly as possible. So we appreciate your patience.
Yes, I am so sorry. I'm trying to text her, and looks like they're not going through because sometimes the phones don't work very well in the hospital. So I'm not sure what's going on, and I do apologize. Yes, we are a local receiving facility under the Florida Baker Act, and we do accept involuntary as well as voluntary patients. So, and we're actually kind of close to that 50% mark, 50% voluntary and 50% involuntary. So, like I said, we do have, it's not only for your psychotic aggressive patients, it's also for chronic depression or mania from bipolar or detox from alcohol, things of that nature. 28-day program if you have Medicare. Anxiety, intense anxiety, obviously, in order to be admitted into the hospital, there has to be, it has to be an acute situation. We also just started ECT, which is electric convulsive therapy. Not as scary as it sounds. It's a new treatment that we started this year. I mean, it's not a new treatment, it's just new to us. And we're actually having really good outcomes. It's for treatment resistant depression or mania with bipolar. And we're going to be having some videos and Facebook Lives with patients talking about their experience and their outcome. And we will have a panel with the physicians and the team who are doing that in order to educate the community, because I know that's an area that most of us don't know much about.
Jessica, do you have an understanding of what percentage of the population that attends Park Royal is, holds some sort of professional occupation like attorney, doctor, teacher, something along those lines, versus, some other type of occupation?
I do not. That is something that we're not tracking. I don't have that. But I can tell you that we've seen everything. I mean, from physician to attorney to football players to, pretty much everything.
Have you seen an uptick in
CEOs.
Sorry, go ahead.
I said politicians, CEOs.
Have you seen an uptick in admissions in recently because of coronavirus and COVID related issues?
Absolutely. So for about 2 weeks when it first started, it was crickets. Everyone was scared to leave their house. And then it just came in, just a mad rush. And we were the busiest that we have ever been. We've broken a lot of records this year as far as most admissions, highest census, most police drop-offs. Our police drop-offs definitely increased. And some of the things range from, you have your psychotics who are thinking that they started the coronavirus, or that they have the coronavirus. Then you have people who are anxious about thinking it's the end of the world or what's going to happen to my job. You have a lot of people who have come in depressed because they've lost their jobs. So we've had everything, in the scope between highest acuity and lowest acuity. We've had, yeah.
Understanding that you're not on the clinical side, have you seen or what have you observed any, of the types of treatments or treatment modalities that you guys employ there at Park Royal to deal with anxiety, depression, whether it's related to COVID or not?
So, so when people come to us, they're in an acute situation. So we have to address what is the highest acuity presenting issue. And we are short-term, so our average length of stay is 7 to 14 days. And we give them tools that they need to go back and be able to cope with whatever they're dealing with. So if it's, coronavirus, to cope with things on a more rational level. If it's depression, maybe give them some affirmations, give them some self-awareness. Like, what is the thing that I'm believing that is causing me to be this depressed or to be this anxious? And what are some things that I can believe instead? How can I affirm myself? What are some things I can do every day that will make me feel good? So they kind of assess the situation, come up with a treatment plan, give them the tools, and then of course refer them to other levels of care. So when they're leaving, they're going to be referred to a therapist, to a psychiatrist, primary care for follow-up, because we're not, the end of we're just the beginning. And when people leave, we're just giving them the tools to live. So they need that maintenance and they need that accountability, and whether it be medication or therapy. So we just make sure that they have the resources and the tools that they need when they leave.
Have you been able to, develop an understanding of what types of, coping mechanisms and things like that are most effective for, stress-related anxiety, depression, that kind of thing?
So repeat the question.
Yeah, what kind of coping mechanisms have you seen that have been most successful for individuals battling stress-related, depression or anxiety? Exercise or, meditation, those types of things.
Exercise and meditation are definitely two good ones. I think responsibility, taking personal responsibility is a big one, because especially with depression, just not tending to your personal business, and that just makes you more depressed and more anxious. So helping them realize that they have to take care of their personal responsibilities every day. Maybe they can't do all of it, but just see what is the most important. What do I have to do today? And what are other people's expectations on me today? And being able to set healthy boundaries and differentiate between those two. That's a big one. Medication sometimes is one. Hold on, I'm sorry. I think Lisa is texting me.
Yeah, and I actually understand that Lisa unfortunately has gotten caught up and is not going to be able to join us today. So
yes,
maybe we turn this into more of an open chat, that if anybody has any questions,
sure.
We can, like Lauren said, include them in the chat box below and perhaps field them as best as possible. But unfortunately, I don't think Lisa is going to be able to make it to the COE today.
Yes, I do apologize greatly for that.
That is okay. I'm wondering maybe if we can all kind of chime in as to what we're doing as people in demanding roles to alleviate or prevent stress that we actually can't control. As we all know, we can't control all of our stress, but what is everyone doing now during such a peculiar time in order to maintain a normal mental healthy balance in their life? I will say that I myself like to walk. I don't do a ton of walking, but I like to walk and just get fresh air and kind of clear my head, listen to music, or cook, which is kind of, they counterproduct each other. I'm cooking fun things and eating them, but I have to walk to justify it. But I think doing the walking, and then I do a lot of lists. If I can write all my ideas down, I can do a list and check them off and not stress because I have a list of things to do. So what are some other things, Jessica, John, or anyone else that you guys are doing during these times to maintain your own mental health status?
That's a good question. I'll go next. You know, anybody who knows me knows I like to run. And any kind of exercise really is a great stress reliever for me. I try to do something, whether it's, you know, big or small, every day in that regard, so that I can burn off some of the frustrations of the day or whatever. And then also making sure to carve out time for to spend with the family and be at the house. You know, no matter how busy I am or get, I try to, you know, say, okay, from X to Y hours of the day, I'm going to be at the house, and I'm going to, you know, put the phone down, unplug it, not respond to emails, not look at text messages, and focus on, you know, my family and I, so that I can detach a little bit, because it seems like, especially nowadays when everything is remote and there is the line of demarcation between work and home is so blurred, it's really hard to completely unplug. And so I've kind of forced myself to do that by unplugging, literally unplugging, and spending some time completely free from connectivity to the office or work.
Yeah, that's a great point. With all of the electronic means, there is a certain invisible expectation to be available pretty much all day, every day. And most of us make ourselves available, which can definitely create additional stress. And with bringing to the point the family aspect, John, that's a great point too. And in order to separate yourself from work and make sure that you're really involved in your family, just as from a, so to speak, 9 to 5, you're really involved in your work. In this, the case of our crowd here, we're really involved in our clients' case files. When you're at home, it's really important to unplug and be involved in your family completely, which does mean no phone, no computer, no emails, just enjoying that time and whatever activity you're doing. So that is a good point. Does anyone else have anything that they do that helps them to relieve stress and kind of take off their work hat?
Yeah, I actually started a workout program in the morning that's on that I do on TV, and I Zoom in with one of my coworkers at 5:30 in the morning. So it's just a good accountability to get out of bed to know that she's waiting, and we don't talk or have really any interaction, but just knowing someone's there ready to work out without even having to leave my home or go to a gym has been really helpful during this time. And another really great resource has been the library. They actually have a program going on right now for families, for kids, adults, and teens, and you can earn prizes. And that's been really fun just to kind of motivate good habits of reading. And they have librarians doing different story times and songs and things for kids. So we've enjoyed that, and it's been a nice distraction.
That's a great point. One of the things I realized while we were on quarantine is that, and this may be common knowledge and I'm just behind the curve, which wouldn't be a surprise, but they have this program called Overdrive, and I learned about it from my kids. And you can check out any library book from the comfort of your own home. And if you got an iPad or a Kindle or something like that, it's free. All you have to do is have a library card. You never have to go into the library. And we've downloaded books for the kids. We've downloaded books for ourselves to read. And reading has been, a great release. It's something I try to do every night before I go to bed to kind of shut my mind down. So the whole library aspect that's a great point.
Yeah, and I also like that you brought in the accountability factor. I think if there's something that a lot of people are suffering from right now, bringing it back to a mental health aspect, is depression is obviously extremely common. But right now, with people either being quarantined, isolated, not going into work, not able to go work out in the gym facility, there's a lot more emphasis on the depression aspect of mental health. So having that group holding you accountable to not only do the workout, but also to get out of your own bubble and make sure you're checking in with your friends, your family, coworkers, etc., gives you a chance to talk to someone outside of the family you're isolated with or the dog that you walk every day. So I think that the accountability factor of that really is kind of key in all of this. I know personally, I isolated for about 30 days when this all kind of started. And now I'm breaking back out into a more public setting, while still being as cautious as I can. But being able to communicate with people in person really does a lot for your mental health. Last night we had our board meeting and we did that in person for the first time since February. And that small interaction with a very few number of us, there was 8 total, I think really kind of revamped my own personal motivation in my own professional life, but also gave me a couple hours of social time, which I hadn't had in a very long time. So I think now we're all getting a little more used to getting face to face. And I think that will alleviate some of the stress and depression that a lot of people are suffering from. But obviously, it's understood that that's going to take some time for a lot of people to be comfortable with doing. But I think that did a lot of good for me personally, being able to be in front of other people in person. Does anyone else have anything that they're doing to kind of help them move along in this crazy time that we're dealing with that, God willing, will be over somewhat soon for us?
And I can say, just as far as like, not necessarily accountability, but friends, I just moved here right before COVID. And so I have a Marco Polo group. I don't know if y'all ever heard of Marco Polo. It's an app and it's kind of like a walkie-talkie. But it's not a Zoom where you do it at one time. So you can get on and just say like a 30-second message. Hey, this is how I'm feeling and this is what I'm doing today. And it's just friends that I have, and we're all over the country now. And so and you don't have to talk every day, but we just get on there and say, hey, guess what I did today? And that actually helped me a lot during the time when I was quarantined and I wasn't really talking to anybody except for work people through Zoom meetings. It's a good way to keep in touch with family or friends.
Yeah, and it doesn't always have to be super healthy either. I mean, I know that I've partaken in my fair share of virtual happy hours and virtual game nights with friends, and that can be a stress reliever, obviously, if if it's done in moderation. But so that's been helpful to connect with folks that you would normally see in person, but unfortunately you can't. My folks are older and they don't get out as much because of concerns, and so we've definitely done virtual happy hours and things like that, which has been great.
I also have some thoughts to share. I concur with like the virtual game nights and things like that. And normally I'm a person that like I follow like really good habits as far as like things to like just keep myself just like excited and motivated. And so I often listen to like just motivational speakers like Tony Robbins. I've been listening to him for like almost all my life. And so I feel like I've gotten out of some of those really good habits during the pandemic because things have just been so different. But some of the things that I've done in the past and things that I'm getting back into is just having like a really healthy morning routine. And that looks different for everybody. But typically, like, I will journal, and I still do that most days, like journaling, like reading things that are motivational. A lot of times for me, that's spiritual things. And even just like exercising and meditating. And like as I started to get out of some of those routines, I heard a motivational speaker say that success is really about progress. So it's not about like exercising necessarily every single day, but it really what it's about is about just trying to do better today than you did yesterday. So that looks different for everybody. And I felt like whenever I heard that, it just made me feel like so much better because I was like, oh, yeah, like I don't have to be perfect at any given thing, but if I could just do a little bit better. So I don't know if that helps anyone, but it really helped me.
No, Christy, that's a great point. I appreciate you sharing that. I know one of the things that I struggled with when I was working from home was um, what I was talking about earlier, like the blurring of the lines between work and home, and having a defined, morning routine and then afternoon routine to kind of segment my day from, waking up and quote unquote being at home to going to the office, which was, right around the corner in my study. And then kind of separating myself in the afternoon, having that defined kind of ritual or procedure that I would go through was very helpful to kind of make those lines more definite and separate the two.
Yeah, I like what Christy said about the word better. So I'm a quirky person in general, as most of you know, but I kind of live by two mottos. One of them is team, together everyone achieves more. And it's super corny to say, but in this particular instance, you have to depend on other people to help yourself. So if you create a good team in your life, professionally and personally, then you will and can achieve more. My second one is be better. No matter what, be better. There's always room for improvement. There's always time and energy to be better. So no matter what you do, if you feel like you didn't do it, next time be better. You didn't eat healthy today, next time be better. It's just two little phrases that kind of help me personally get through any stressful time that I'm having. So team, together everyone achieves more, and be better.
I love that. That's a great motto. And I just want to just agree with everything everyone is saying. Journaling is great. I love to do that. So I get up really early and drink my coffee and just kind of meditate and have quiet time just to make sure I don't take any old feelings into a new day. And then at night, I have to have the quiet time just to make sure I can, do the same. And during the quarantine, I got up every morning and got dressed as if I was going somewhere. Instead of doing I know a lot of people did the no shaving and the yoga pants and everything. And that's great. And there's nothing wrong with that. But it helped me just separate work from non-work. And it helps me, I feel better if I look better. So if I have my makeup and my clothes on every day, then I know that I just feel better. So I did that every day, no matter what. And it's just about knowing yourself and knowing things that make you feel better and knowing the things that might make you not feel good.
Yeah,
And I know a lot of people have done, meditation or yoga or things like that to help with kind of mindfulness. I'd be interested to know, obviously, it's been harder to do that thing in a group setting because of coronavirus. Has anyone had any success with any apps or programs where they've been able to, remotely do yoga or mindfulness or meditation or, soothing sounds, that type of thing, whether it's through the internet or some app. I'd be interested to hear about experiences with that, if anybody has any.
I have a yoga playlist on YouTube. I love yoga, and YouTube has so many options for yoga. I know there's apps out there, and I've tried some, and I haven't liked them as much as YouTube. And I know Xfinity cable has I haven't liked that as much as YouTube either. YouTube has been my favorite, me personally.
Well, that's good.
Just looking at our attendance list here, and I noticed that Jennifer Lucas Ross is here. Jennifer, are you able to speak to what Ave is doing to kind of help and encourage and harness some healthy ways for the students to deal with the lack of seeing their fellow friends and classmates, and what they were doing while the school wasn't allowing kids on campus? I know that she's here, but I totally put her on the spot, but I'm very curious to know what they're doing over there.
We're getting very creative here with our.
We are. John Webb, what are you doing to make sure that you're keeping your mental health in check?
A lot of exercise.
Care to elaborate on the type of exercise?
Sure. I started P90X several months ago. I'm doing a lot of running, and really just a lot of outdoor activities.
So fresh air has helped you, P90X and running.
Yes.
Is there anything that you're promoting in your office to help your staff keep their mental health up?
Well, sure. I mean, obviously, we have check-ins with one another and talk about, just the environment that we're currently in dealing with this crisis. It's a very serious situation. I think mental health in some capacities has kind of, been a little bit disregarded is, probably the only way to kind of describe it. Unfortunately, during a lot of this, people are locked in and, we've had the shutdowns and everything like that, which obviously affects people on a number of levels. So it's important just to ask people how they're doing and what's going on in their lives and making sure that everybody's okay. So we're very open and talk about just the experiences that we're going through and how our families are doing and everything else. I know for me individually, my family's in Louisiana right now dealing with this, and obviously there's been 5 named hurricanes go through there this season. So there's a lot of going on over there, and so it's important to check in with people all around, not only in the work environment, but also family members, friends, and everything like that, because everybody in this country right now is going through the same experiences.
Absolutely. And that's a great point too. A lot of people aren't able to see their family, friends, and maybe clients. So a lot of people are doing electronic things, which, as we've all said, is wonderful as an option. But the in-person aspect really is just, I think, far more appropriate to maintain sanity for sure.
I think another thing that can be helpful is, being an outlet for somebody else. I'll tell you, one of the maybe coolest things I've seen during COVID is part of a lawyer organization, and we have board meetings like every other organization, and they've all become virtual. And at the end of the board meeting, like most boards do, there's a for good of the order, and everybody kind of says a good thing or whatever. But they added an agenda item after for the good of the order, and they called it the hard stuff. And it was, if anybody is going through anything hard, whether it's just stress from COVID or a divorce or some family member that's ill, it was an opportunity for individuals on the board to kind of speak their mind on those topics and to know that they have like an audience who's going to receive it, support them, not be judgmental. And I just thought it was super cool because I have never seen a group of attorneys who are usually, in most cases, fairly reserved individuals, especially in, professional settings, open up like that to relative strangers. And I think it was helpful for the folks that were talking about their problems because they got to talk about it. And it was helpful for those who maybe didn't feel comfortable enough to speak, and they were able to hear, hey, I'm not alone in problem X or problem Y. There's somebody else who's going through the exact same thing as me. So I thought that was neat. And so kind of just being an outlet for somebody or a group of people, whether it's in the office or family members or whatever, can be, rewarding and helpful.
Absolutely. Oh my God, I love that so much because, of course, being in behavioral health, most of my friends are therapists, social workers, or in the behavioral health field somewhere. So we naturally do that because we naturally look for signs, and we just do that. So I attended a panel that was titled "The Day the World Talked About Mental Health." And so we've kind of been the redheaded stepchild, in the corner. Nobody talks about it. It's those people kind of thing. So for this to become more mainstream, to have attorneys talking about it and their meetings, and to have everybody kind of stopping and paying attention how the people around them are feeling is music to my ears, because we all need that listening ear, and we all need to be that listening ear for others. And there really is no better feeling than to be able to help another person. So I love that. And that's very therapeutic to be working in an environment that is open and that is supportive. So kudos.
Well, I wish I could take credit for the idea, but
I
And
think
I'm also from Louisiana, so I spent all last night watching the Weather Channel. I feel your pain.
How is your family doing over there?
They're good. They lost their power until about midnight, but other than that, everybody's fine. How about yours?
Oh, they're fine. We're in Lafayette, Louisiana, about 2 hours east, so we're fine. The other
Okay.
storms affected them a lot more, the ones that went through Lake Charles and that.
Yeah, Louisiana's gotten a beating.
Yeah.
well, I think we're rapidly approaching the point at which the Florida bar will give us CLE credit because we've gone long enough. But does anybody else have anything they want to add? I really appreciate your flexibility on, the alternative format here because of the last minute change. Anybody have anything that they want to talk about, think is helpful, something that you've experienced, either coronavirus or non-coronavirus? I mean, our jobs were stressful enough before the pandemic. So happy to hear from anybody on any of those topics.
I will say that obviously mental health is a stigma internationally, but particularly in all of our fields, with this being such a highly regarded profession, the legal world that is, the Florida bar has recognized that most people do want to remain anonymous and not disclose their suffering in one way or another. And the Florida bar has been kind enough to open up a free hotline for legal professionals to call and just kind of talk about their problems with medical professionals and non, to just have a friend that's anonymous, that's not going to judge, and that doesn't know you in person. So there's no prejudgment. So if for some reason you are suffering in any type of way and you're not up for speaking on a CLE or talking with your friends or family about your problems, please don't sit there in silence and suffer from whatever your ailment is. Call the Florida Bar Hotline and just talk it out and get some help. There's a lot of people in the legal profession that deal with more stress than many other professions. And there's no need to suffer in silence. There's plenty plenty of people that would love to hear from you. I myself am happy to take a phone call and talk you through whatever you're going with and help you in any way I can. I extend that to anybody. But again, do not suffer alone if you're going through something. And obviously, as a facility, Park Royal is here to offer inpatient and outpatient treatments. So that's an option as well if you want to be in a facility. But for just a phone call that's free, that you don't have to say who you are, just to get something off your chest, definitely call. Do not suffer alone. Nobody wants to see any of our peers or anybody in our community suffer from any mental or any physical ailments.
And I can also say, if you do want to talk to a professional and you don't need acute services like what we provide, those therapists, they're talking to people. And, like I said, I am friends with therapists in private practice, and they're talking to people. They're not judging anyone that's calling them and that's struggling, because they've had struggles too. So they're definitely not judging and are open to listening and helping.
Well, like I said, I really appreciate everybody being here and being flexible with the format. If there aren't any additional questions, comments, we can go ahead and kind of wrap things up here. Obviously, if you think of anything after the fact, feel free to reach out to Lauren or I. I can put my email in the chat, and everybody should have Lauren's. But thanks for being here, and we'll see you next time.
Thank you, everyone. And thank you.
And thank you, Jessica, for being here as well and fielding the questions.
Thank you.
All right, everyone, I will send out CLE certificates to everyone who attended. We thank you very much for your attendance. And again, for being flexible with us. John, thank you. Jessica, thank you. And everyone have a great day. And remember, do not suffer alone. There are many people just like you if you're having a problem. Everyone have
Thanks,
a
everybody.
great Thursday and Friday.
Bye-bye.
Thanks
Bye.
so much. Bye.